So thanks so much for the opportunity to speak with you today. And really, what I'm hoping to touch on today is exercise. Why does this matter for men after prostate cancer? So basically, just going to go through very briefly exercise and cancer generally, talk about exercise specifically and related to prostate cancer, talk about the focus in the field now to try and take research we have and move it into practice, and just highlight some of the things that we are testing right now in our own research and hope to see maybe some of you participate, and then talk about what's new, what's next for the research in the field. And I'm being a bad Zoomer. I've got too many things going at the same time. I can't advance my slide. Okay, one moment. There we go. That out of the way. Hopefully that works. There we go. Okay, so as Rochelle mentioned, in 2019, there were new guidelines for exercise for people during and after a cancer diagnosis that were published by the American College of Sports Medicine. And for that, an international group of experts and stakeholders came together and looked at all the literature that was available from randomized trials and meta-analyses and systematic reviews to try and pull together what the update for the guidelines should be. So currently, these are the current physical activity guidelines for anyone that's living with and beyond cancer. First and foremost, to get started, avoid inactivity, moving more, and sitting less benefits nearly everyone. Then for overall health, aim to meet the current exercise guidelines for adults, which are moderate aerobic exercise, at least 150 minutes per week, or vigorous exercise, at least 75 minutes per week, or a combination of the two, and resistance exercise 2 days per week. So moderate intensity activity is definitely your heart's beating harder, you're breathing a little bit harder, but you can still carry on a conversation with the person next to you as you're exercising. Vigorous exercise is heart's beating a little bit harder, breathing a little bit harder, and you may have to take a couple breaks in the sentence as you're trying to talk to the person next to you. That's usually how we try and designate the two. So brisk walking might be moderate exercise. We heard someone riding their bike. If they're riding up a hill, that might fall more into the vigorous exercise category. And resistance training is strength training, lifting weights, doing body weight exercises to try and improve muscle strength. And also, too, with these guidelines, there was a real focus on addressing the symptoms related to many common cancer treatment side effects. So what the research generally showed is that a lower bar of activity can actually help with cancer-related fatigue, health-related quality of life, physical function, anxiety and depression, as well as there was moderate evidence for potentially improving bone health and sleep. I can talk more about those two if people are interested, but for now, I'll focus on sort of the other three. Lymphedema is more related to breast cancer treatment, so I won't go into that today. But generally, the bar here is 30 minutes, 3 times per week of moderate intensity aerobic activity. So that's more like 90 minutes, plus 2 days a week of strength training. So that's where we've definitely showed was potentially beneficial for addressing these common side effects of cancer treatments. So what about prostate cancer specifically? So cardiovascular disease, we'll talk about that, muscle strength and muscle amounts, mood, anxiety, brain health, bone health, as well as overall physical function and activities of daily living. One of my colleagues made these slides, and apparently she thought people should be dancing, so she used that, that slide. So overall energy and mood, regular exercise really has been shown to be more effective at reducing fatigue than any medication that's available currently on the market. So supervised exercise usually tends to have a stronger signal than home-based exercise. Traditionally, that has meant sort of on your own, not necessarily virtual exercise at home, which we'll talk more about. Thanks to COVID, we've kind of moved into a new regime there. Moderate to vigorous intensity activity tends to help with energy and mood more than just mild activity or low levels of activity. And for those that are on androgen deprivation therapy, so here summarizes ADT, resistance training tended to show the most benefit for energy and mood. Higher volumes of activity were also shown to relate to lower levels of depression and feelings of anxiety. And when we looked at the literature, it really was structured, group-based exercise that showed a stronger signal than any other type of home-based or individual exercise. For urinary incontinence, some research suggests that pelvic floor exercises done pre-surgery have been shown to improve post-operative continence at 3 months, as well as meeting these physical activity guidelines. So that was the 150 minutes per week of aerobic activity and 2 days a week of strength training. Meeting those guidelines pre-surgery led to an improvement in continence at 6 weeks post-operative and less post-operative complications. In terms of masculinity and body image, this is some work done by a physiatrist, Dr. David Langelier, in Toronto at UHN. And what he found is that in looking at questions around body image, this is a quote from some of his qualitative work. Regardless of prostate cancer stage, both aerobic and resistance exercise exerted positive effects on feelings of masculinity, body image, and personal identity. And overall exercise really helped to reestablish confidence. And then some of the side effects related to beyond androgen deprivation therapy. So ADT does tend to lead to an increase in body fat, around 10%. And this is a concern because that increase in body fat can increase risk of cardiovascular disease. That's what the short form CVD is, as well as increased risk for developing type 2 diabetes or having metabolic syndrome, a precursor to type 2 diabetes. There also tends to be a reduction in muscle mass, and the concern here is physical function, being able to do the activities that you would normally want to do, and also a reduction in bone density. And here the concern is osteoporosis or osteopenia, a precursor to osteoporosis. So this is where exercise can play a benefit here as well, specifically. So resistance exercise plus impact exercise. So by impact exercise, what really stimulates bone is you have to load the bone and give it a force that it has to realize, oh, a force is going through me, I need to sort of recalibrate slightly, and it tends to add more bone. And so those are things like jumping, carrying heavier loads than you would normally do with just your own body weight. And we can talk about that if anyone's interested. But generally, resistance training as well as this impact type training can attenuate loss in bone mineral density. That's what BMD stands for. It's a small amount, but it does take a lot to change the bone. But exercise does improve skeletal muscle mass as well as muscle strength, so really helping with the physical function elements. And aerobic plus resistance exercise has been shown to decrease fat mass and improve overall body composition, so that the balance between muscle and fat, and diet and exercise are really playing an important role there. And those then will help to decrease risk of cardiovascular disease and type 2 diabetes. And, as I mentioned here, heart disease or cardiovascular disease is the most common cause of non-cancer death in men with prostate cancer. And so with ADT, it does, as I mentioned on the previous slide, increase these cardiovascular risk factors around abdominal obesity and metabolic changes that come with decreases in muscle mass, which is sometimes termed sarcopenia. And overall decreases in activity tend to exacerbate these symptoms as well. And so exercise has really been shown to be a very effective tool over many years to decrease cardiovascular risk factors and improve heart health. And so that's the real focus on increasing physical activity for general health, is to address cardiovascular risk factors. And last but not least, this is some very preliminary data that's observational. So whenever we think about survival, basically what has been asked is that they've asked people who have had a prostate cancer diagnosis, how active were you, and then follow you over time. And so it's not experimental. There's no cause and effect here. It's just an observation. And this is work by Christine Friedenreich from the University of Calgary. And what it basically shows here, these graphs in blue are those that were most active. So they use a quantification of the amount of activity, which is in time, and an intensity of the activity to come up with this thing called the metabolic equivalent, or metabolic hours per week. So more metabolic hours means more activity. And what they basically showed is that those who were most active, so here that was a cutoff of 119 met hours per week, more individuals were alive at the end of 16 years, which is what's been shown on the bottom here, compared to those in the red who were the least active group. And that is showing over time, 100% is the top, 0% is the bottom. And then you can see over time that those who are most active had better overall survival. So that would be cardiovascular disease, diabetes, any type of cause of death. So greater exercise levels were associated with improved survival rates. So hopefully now I've convinced you that about exercise. So, that's great, Kristen. What am I supposed to do now? Well, let's hope we can give you some ideas. So what we have really been focusing on in the field of exercise oncology is how do we move the research we have into practice? And so we have shown that exercise is really effective, but how do we deliver that in a way that is effective to be in a community-based program and sustainable? How do we keep this going? How do we make sure that there's services available to people like yourselves who are interested in being more active? So that's the real focus. And so we've been really focusing on something called the RE-AIM framework to try and help us move that research that we have that shows that exercise is good and move it into practice. So RE-AIM stands for reach, effectiveness, adoption, implementation, and maintenance. And what that's basically trying to show is how do we design projects so that we can test what kind of interventions could reach the population we're looking for, so reach our targeted population in blue, show that it has a benefit or is effective, which is the green square here, and then understand in orange the adoption. So how do we actually develop institutional or community-based support to deliver the intervention so it can be sustainable, live on in the future once, say, a research grant is done. And purple is implementation. So how do I ensure that the intervention is delivered properly? So we tested in a research study, we want to move it out into the community. Are all the active ingredients still there? Are things missing? Does it still work in that environment? And red is our maintenance. So how do we incorporate the intervention so it can be delivered over the long term? We test out something in the lab. How can we get that program to be available going forward? So that's the RE-AIM framework. And our research is sort of testing all of these different elements. So the first thing that we've been testing is the Prostate Cancer Supportive Care Program. So those that live in British Columbia may have had access to this program. This is run through the Vancouver Prostate Center and is free of charge. And this is part of their overall supportive care program. There's an exercise module, which is one element of their lifestyle module. And so the lifestyle exercise module started in 2014, and we called this program 1.0. And what it was 4 times, people got 4 sessions with a clinical exercise physiologist. And it was behavioral counseling, understanding where you were at with your activity now, looking at some of the interests and goals that you had, and really coaching you towards reaching the current physical activity guidelines for health over a year. So you got visits at start, 3 months, 6 months, and 9 months, and then you were followed up at 12 months. What we did then is we actually did an evaluation of how that program was working, and it caused us to have some thoughts about how we could improve it or change the structure so it better met the needs and the goals of the program. So what we did in 2018 is we revamped the program. We now call it Program 2.0. Now we had a group education session. What we recognized is that the first session of the in-person exercise consultation was a lot of it was taken up with educational components that probably could be delivered in a group setting. And so that was what was done here. All that sort of content about what activity was, why it was beneficial, some of the content you saw today, that was put in a group-based education session. Then people came to have their first one-on-one session with the clinical exercise physiologist. All that teaching part had been done. They could get right into the meat of exercise counseling. We added a 1-month follow-up phone call, knowing that a lot of information is provided in that first session, and we really wanted to connect to people earlier to make sure that everything made sense. If there were any questions or concerns, those could be addressed really early on, such that when you came to your 3-month visit, already you're ready for new discussions, changing things around, and progressing your exercise prescription. So that proceeded on at 6 months and 9 months as well. So that's the structure of 2.0. So What we found from our analysis, early analysis of exercise program 2.0, is that the mean age of men who attended was 68 years, but had quite a range. The average time since diagnosis was about 24 months. And people had had a variety of treatments. So a lot of people had had surgery, as well as about a third had had androgen deprivation therapy, and a quarter had external beam radiation. In terms of self-reporting, what kind of activity levels you had coming into the program, 47% did not meet those current exercise guidelines I showed you at the start, and only 27% met that strength training guideline of 2 days a week of resistance training, whole body exercise for the main muscle groups. In terms of attendance, this was one of our main outcomes. Like, if we offer a program, who shows up? Do people, continue with us? So you can see here, this is our first session here was the education session. Of those that signed up, just shy of 70% of people actually attended the session they were booked for. So we were pretty happy with that. You'll see this green line here is 60%. That's what we set as the bar for success before we started the study. Of those that came to the education session, 95% came to Clinic 1. We did lose a few at that stage. You can see here at Clinic 2 at 3 months, 80% of people attended. And here we have Clinic 3 at the 6-month mark. We had 80% of people attending as well. So really good follow through and really good attendance, which suggests that people were getting a benefit from the program and wanted to continue on with it. We also showed an increase in the amount of moderate to vigorous exercise reported. So I'll just orient you to this. So blue is our mild exercise, is our education session. So when people came for that first education session, filled in a questionnaire. And this is the amount of mild exercise that was reported in blue. Moderate activity, you can see here, was the second thing here, which was our 1 month, first clinic was black here. And our third clinic here is this kind of houndstooth. We made this so it could look okay in black and white too. So it's kind of funny colors, I appreciate. So what basically this is showing is that mild exercise, moderate, vigorous, or moderate to vigorous activity, you can see from the education session, there was less activity less mild activity over time, an increase in moderate intensity activity across the 3 visits, an increase in vigorous activity across the 3 clinics. To overall, this is sort of meeting our physical activity guidelines at 150 minutes per week here. Oh, we didn't even have one person maybe not on mute. Hear a little bit of background noise. What you can see here is that by the first clinic, and certainly by that third clinic, the majority of individuals were meeting that 150 minutes per week of activity as an average. So we really thought that was very successful at getting people to meet the goals. Other thing we really took away, this is now looking at Clinic 1 versus Clinic 2. The addition of the education session also had an addition of an exercise sheet. One thing we were disappointed with Clinic 1.0 protocol was that we didn't really move the needle too much on strength training. And so we took a look at that, retooled things, and at that education session, talked specifically about the importance of a resistance training and gave people a little bit of a 1-page, well, it's 2 pages, exercise sheet for exercise to do at home. And what this graph is showing is this is the average number of resistance sessions per week, so 0 being none, 4.5 being, 4.5 times per week. And what you can see here is that people were getting about like half a session in, give or take, as an average at the Clinic 1.0. But once we got to Clinic 2.0, over 3 months, we saw that people were meeting that target of 2 days a week of strength training with the combination of education, exercise sheet, and that behavioral counseling from the clinical exercise physiologist. So we're really happy with that. So in terms of next steps for the evaluation of the Clinic 2.0, what I showed you today was our preliminary analysis that was done by Sarah Weller, who is a master's student. She laid the framework for it, and now we are going to be looking at the first 200 people who completed the 1-year visit. We are putting the ethics in May 1 to get do a chart review for individuals who have attended that clinic. So that's where we will be reporting on how that exercise clinic, which is basically one-on-one behavioral counseling with education, how does that actually change physical activity levels, physical function, quality of life in individuals who've had prostate cancer diagnosis. So we're really excited about this opportunity because it's a free program that is run through a larger clinical setting, and just understanding what the potential benefits of that model of delivering exercise and promoting exercise will be. The other thing we're testing is, while the clinic itself provides one-on-one behavioral counseling, it doesn't provide exercise classes. And so that was one gap that was identified in some of our focus groups and some of our questionnaires and satisfaction questionnaires from the Prostate Cancer Supportive Care Program, is people wanted places to go and do exercise. And so this is the SIRvivor BC exercise program for men with prostate cancer. And what we're testing here is what's the acceptability and uptake of a community-based exercise program run by community centers. So we took a look around the province of British Columbia and thought, well, who would be the right partner to try and see how exercise programs could be delivered closer to where people lived. So we partnered with BC Recreations and Parks Association, and I'm based at UBC, and we got funding from the Vancouver Prostate Centre to try out running exercise programs with community center partners around BC. So who is the program for? This is open to any men 19 years or older who have had a prostate cancer diagnosis in any stage of treatment or recovery, and they have to pass a pre-exercise screening with a certified exercise physiologist. So that's a phone call where someone just asks a little bit about your health history and make sure that you're appropriate for the program. This program does have a cost. So the question is, why does it have a cost? What we recognize is, for this to live on sustainably into the, going forward past a research study, we have to find a way that it makes sense for the community centers to offer it. And so we worked on a cost recovery model with them. We also wanted to entice people who maybe were a little bit hesitant about exercise or just weren't sure, they hadn't tried it out before. We wanted to offer a reduced rate. So the idea here is that for first-time participants, it's $50 for a 12-week program. The program runs twice a week, and so that is $2.08 per class. For returning participants, we are charging more like the full charge of the class, which is $120 for 12 weeks, so that's $5 a class for the 24 classes. What this is a cost recovery in that it pays for the exercise trainer. So the community centers, because they have a mandate to deliver services for the community, they offer us the space in the community centers for free, and all the infrastructure and time it takes to register people and collect fees and things like that, they donate that, and all the funds go directly to just paying the exercise trainer. And so that's sort of the lowest cost model that we could develop that made sense for the community center to be able to offer the program. What does the exercise program look like? These are images courtesy of the True North Initiative, which was an initiative funded by the Men's Health Foundation several years ago, and developed the exercise program developed by Dr. Nicole Koulos-Reed in Calgary. And so you can see here we have some seated exercises, some floor exercises. Here, obviously, this is the in-person class, so there's access to exercise balls. This person on the far left is doing a sort of supported squat, wall squat with a ball. We've also been able to transition this to virtual programming, which I'll mention as well, that requires not much activity equipment. And what the goal of this program really is to meet the needs of men with prostate cancer and be able to tailor it to pretty much anyone who comes through the door. So there's a lot of different variations and options of all the different activities to meet people where they're at. And this is just the plug for the virtual supervised exercise programs. So one potential silver lining for COVID is it allowed us to really rethink exercise programming and how we might be able to deliver it differently and reach more people. Already pre-COVID, we'd identified that Prince George was one site we really wanted to get an in-person program going. But we heard from those that we talked to who are our stakeholders in Prince George that it just was a little bit difficult because of the distance. People typically would travel to come into Prince George for that type of programming. So 2 days a week was seen as sort of, it was too far. So we already were designing a virtual program, and it was supposed to roll out right before COVID hit, and then COVID hit. So what we've basically done is taken that Northern Prince George program that was supposed to be virtual and opened it up to the entire province. And so what you can see here, this is an example of one of our exercise trainers teaching from her home. She's got a chair there in her hand. She has an exercise band. And so we really have been able to successfully transition the SIRvivor BC program to a virtual program as well. And that's been running over the last 2 or 3 years consistently. So if you're interested in SIRvivor BC, it's being new sessions are starting this spring. I'll highlight here the virtual program here. This starts April 6th, so coming up quick. And that is open to anyone in British Columbia. I know we have people from outside British Columbia on the call, and certainly we haven't gone farther and wider than British Columbia, but certainly we can talk about that. We also have in-person programs running again in the city of Kelowna, Richmond, Campbell River, North Vancouver, and Surrey. This is in partnership with a PT clinic, so that is where it's being run there. We've also partnered with the Senior Center in New West and other places like that to try and get the program close to where people are living and where they want to have exercise. And if anyone from Campbell River is on the call, that was interesting that the SIRvivor group, support group there, came to BCRPA and said, we heard there's this program, we want to run one in Campbell River, and we've been trying to get one in Courtenay and Comox area. So that really has been a nice start to that program, is having the instructor trained as well as a ready group of people really interested in the program. If you are interested and you want to enroll or get more information, you can email survivorb.bc@ubc.ca, or this is our phone number for our lab, 604-827-1914. These are just some quotes from people who have been through the SIRvivor BC exercise program. Even though I was going through radiation, which kind of dragged me down, I kept going and I felt good. That's why I went back and why I'm going back again. I did some training before at the local senior center. The other program wasn't really geared for prostate cancer survivors. This one is targeted. And the last quote here, they've got really good instructors, but you've also got the continuity of being with the other guys who have gone through the same situation as you. And that's why I've designed this particular program, is really allowing people to exercise with individuals who have gone through something similar to them and have instructors who have experience and understanding of some of the experience that individuals have gone through. We have some nice testimonials, so really thanks to Glenn and Marilyn and Lawrence for being willing to provide testimonials around the program. I haven't found a great way to link to them on YouTube. I'm sure I can give the link to Rochelle, who can circulate it. But if you want to find it on YouTube, you search Clinical Exercise Physiology Lab SIRvivor BC. And these clips are about 4 minutes long, and you can hear more about the exercise program. Glenn and Marilyn have been part of the virtual program from day one, and Marilyn participates off camera, so she's been doing the exercise as well as Glenn at the same time. We also have some wonderful people who I've seen on the call here who are also giving us advice about this program too, so thank you for that. What also is new is I just want to highlight here, this is our newest program. This is SIRvivor Plus, and so what we recognize is that the SIRvivor program, hello? Is there a question? Oh, sorry. The SIRvivor program, the one challenge is that the exercise professionals who run it are certified to work with older adults and those with sort of very straightforward chronic conditions. So we had a number of individuals who had bone metastases who were interested in the program, and the exercise trainers weren't qualified for that just yet. And also there were some individuals who had more other exercise needs that were not being met by SIRvivor BC. So if there were challenges around mobility or more complex health conditions. And so what we've been able to do is develop a program just for you that's going to be running for the first time this Tuesdays and Thursdays starting April 19th. It's at 10 to 11 a.m. And this is actually instructed by one of the clinical exercise physiologists from the Prostate Cancer Supportive Care Program. So anyone in BC who has worked potentially with the Victoria site may have met Joy in the past, and Joy is going to be the instructor of this program. This one is no fee. So we're researching this particular program and understanding how it can meet the needs of these individuals in the best way. So we have a bit of funding from the Vancouver Prostate Center to develop this particular program. If you're interested, you can still email survivor.bc@ubc.ca or the The research coordinator is Sarah Campbell, s.campbell@ubc.ca. She is no relation to me. We just have the same last name, as we heard about earlier on the call from those that had the same last name, Gross. And you can also phone our lab there. So we're really excited about this program and hope that this can better meet the needs of all the men in British Columbia and make sure there's options for everyone. We also developed a one-stop shop for all sorts of information around exercise, particularly after a cancer diagnosis. It's based around British Columbia, but it has information that is available for anyone across the country. It's a one-stop shop. It's www.cancerexercise.ca, and there's all sorts of information on there. We're trying to compile it, so there's only one place you have to go to find all the information that you're interested in. I'll just highlight two other programs that are run by researchers in other parts of the country who we're helping them with those projects. This is one based in Toronto, but it's open to anyone across the country. It's called iStride, and it's a distance-based randomized trial for reducing sedentary behavior among prostate cancer survivors. So this one is very much about moving more, sitting less, and doing that from the comfort of your home. So it's, again, for men with prostate cancer, 18 plus. This is for individuals who are engaging in less than 150 minutes per week of physical activity right now and are not receiving chemotherapy or radiation. And this is really focused on sort of all those activity trackers that you may see people wearing, Fitbits, some of you may have them here. It really is getting people moving more, sitting less. And so there's 3 assessment points. It's all done virtually, and it's a 12-week program with or Fitbit and a support, or just a Fitbit with health resources. So if you're interested in that, that is to get you up and moving a bit more, not necessarily structured exercise, but just moving more. Exercise.oncology@utoronto.ca. There's a little video here, but in the interest of time, I won't play it here, but it's a little informational video, which you can find on our website as well. And last, this is the Excel program. This is run out of the University of Calgary. Also has reach across the country, and it's exercise programming that is for any type of cancer. And so the goal here is similar to SIRvivor, exercise-based programming, close to where people live, but for anyone with cancer. And so they have also gone virtual with COVID, and so there are some virtual exercise classes running as well. So if the SIRvivor BC times don't work for you, or you're interested in other types of programming, this may be an option for you. You can email them at wellnesslab@ucalgary.ca. They also have, University of Calgary, and you put Excel in, I think you would get to all the information on their programming. And this grant is really focused on meeting people in rural and remote areas of Canada, knowing that there's fewer services there and less access to exercise trainers in those communities as well. So with that, I'll stop and take any questions I think I might be handing it straight over to Vince at this point too. So just let me know, Rochelle, what we're doing. We may be taking questions at the end.
Yeah.
Oh, sorry. Go ahead, Mia.
Yeah, it's fine. We will be taking questions at the end. So thank you so much, Dr. Campbell, for your presentation. And I will be introducing our next guest